here, which is fantastic. Hopefully most of you already know a bit about SOURCE. We're not doing the whole overview of SOURCE. We're really focusing on the academic engagement opportunities, things that tend to be a little bit more scholarly in nature. Just for the quick overview, we are the Community Service and Service Learning Center for 3 different divisions here at Hopkins: medicine, nursing, and public health. And we do everything from simple volunteerism, one-time service projects, service-based student groups, to service learning courses, community-based participatory research, and all different types of scholarly opportunities for our students to engage in the community. And one thing that we really try to focus on through SOURCE is that the engagement opportunities that we offer to students are actually identified by you, the community organizations. It's one of our core values, is that we really try to respond to community identified needs, which means that we need to be in constant communication to figure out what's going on with your organization, what are your current needs, what are your programmatic issues that are going on, to figure out how we might be able to bring mostly students, but of course faculty and staff on board as well. So that's the quick spiel, if you would. Now, today what I want to quickly do, this is the overview. First of all, hopefully everybody did grab one of our yellow packets. There's a lot of information inside of these packets. First, I'm going to point out on the left-hand side is this orange handout. Now, this orange handout, we gave you all pens as well. We want you to be filling this out as we go today. And as a matter of fact, if you need a parking pass at the end, this will be your ticket to get free parking. As a reminder, there's a couple of you that have more than one representative from your organization. As we said in advance, we can only do 1 parking pass per organization, and the rest is at your expense. So anyway, for this, I'm going to be going over some details about the various opportunities. And as I talk about them, if you have an idea that comes to mind, you can write it down here. There will be plenty of other opportunities to give us ideas, but this is just to kind of think while you're here. The other items that you have inside of your packets, you do have a printout of the PowerPoint slide, so you can take that back with you. You do also have a printout of the core competencies for public health professionals. I'm going to point out this throughout the presentation because a lot of the type of work that we're going to be looking for, particularly related to the MPH practicum requirement that I'll go over, should relate back to the core competencies of public health professionals. So I wanted to make sure that you all had a copy of that, and you'll see that they are very diverse. You also have an information guide about a course that I teach, which is the Baltimore Community Practicum course. I'll hit on that as well. And the last handout that you have, again, is Practicum Opportunity site will be live in July. So this is all going to be live in an online system, but I can already prep you to say this is what's going to be inside the system if you want to submit project ideas. So I'm just basically trying to get you to have advance notice of how we're going to be collecting details. Okay? All right, so we are going to have a chance to do real quick introductions. And as I mentioned, the main purpose of today is to do a quick overview of new academic-based community engagement opportunities. The 2 main things that I'm going to be focusing on are the MPH practicum requirement, as well as the growing number of service learning courses that we have in our 3 schools: medicine, nursing, and public health. We're also going to touch base with you all about ideas for some training materials for community preceptors. And finally, at the very end, we will, basically have a little bit of time for you to sit and fill out a little bit more after you kind of quickly absorb what I'm talking about today, potential project ideas that you might have at your organization. So let's just jump right in. As I mentioned, I want to make sure that we have a chance to go around and do welcome and introductions. Our room is actually set up incorrectly. We were supposed to have a big U, which is why you have like kind of the nameplates in front, so we could see each other. But I'm going to pass around a microphone real quick that you can just pass down the line so everybody can hear each other okay. And basically all we want you to tell us is your name and title and which organization that you've been working with. And if you have had experience working with students for an academic experience, you can share that. If it's been strictly voluntary, you can just say, I haven't done academic work yet. Okay, so I'm going to start with Bilkis because she's right in front of me.
Hello, my name is Bilkis Rock. I'm the volunteer coordinator at Healthcare for the Homeless, just under a mile away along the Falls Way. And I believe we've worked just 2 times with academic students on projects. One with community health nursing course, doing some health education with our clients, and then also with a qualitative research course through the public health school. They did an excellent study of the clinical benefits of advocacy activities for our clients that we had kind of known anecdotally, but now we really have some nice evidence to use when we're talking to folks about it.
Hi, I'm Faith Saville. I'm the Community Relations Specialist for the House of Ruth, Maryland, which just means that I'm the volunteer coordinator. My experience working with students for academic credit, very similar. These kind of like once-off projects where students in the public health school would create kind of a workshop for our clients. This is at a previous agency on nutrition or whatever they thought that the need was. They did a bunch of different things like that.
Good afternoon. My name is Amelia Conlin. I am the training and education coordinator at the House of Ruth with Faith. I have supervised multiple social work interns at the House of Ruth, and I've also kind of worked. We get nursing student people from from Hopkins who are doing part of their thing at our health clinic. I don't know proper things, so.
Good afternoon, I'm Sally Drum. I'm with the Greater Maryland chapter of the Alzheimer's Association. And we have not had any students from the School of Public Health, and we would like to.
I don't know if I need this. Can you guys hear me? Okay. My name is Roxanne. I'm the Volunteer Development Vista at Habitat for Humanity of the Chesapeake, and we haven't done academic credit yet, but it's one of the programs I'm trying to develop, so I'm here.
I'm Jessica Drake. I'm from the Living Classrooms Foundation. I'm the Director of Community Outreach and Volunteerism. We have done class-based programming at Living Classrooms with Johns Hopkins. We've had the Child in Crisis class, who was amazing, if you have an opportunity to work with them, as well as we've had students from, and I'm forgetting the class, but we did a wonderful art project where they helped students design health-based comic books. We've also had numerous volunteer events. What was it? Thank you. I was wondering what it was.
Hi, my name is Margaret Schnitzer. I work with the Baltimore City Health Department. I manage our asthma program. We have certainly worked with students before, last year through SOURCE, and other nursing students in our program. And that's it.
Hi, I'm Ashley Hartman from CASA of Baltimore, and we advocate for children in the foster care system, and we don't have anyone from public health, but we have a social work intern, and I know because I'm that person, and and I assist with recruitment of volunteers and training them.
Hello, my name is Evangela Brown. I'm the manager for volunteer training and recruitment at CASA of Baltimore. We do not have anyone from the School of Public Health as yet, but we do work with interns and work study students. And we're actually going to be working with some other students from Towson University, hopefully as well.
My name is James Bion, and I work with the Episcopal Refugee and Immigrant Center Alliance. I'm their outreach and volunteer coordinator. Our experience with students is we have students come and present health and educational workshops to our refugee clients who've just come to America, and they help develop that curriculum.
Good afternoon. My name is Renee Brock. I work at the Doerr, which is also called the Baltimore Urban Leadership Foundation. And I am on the board, and I'm also an acting COO. We're stretched for resources. And we have had opportunities for credit, but with UMBC students. Maybe sometime in the past we have with public health, but not recently. We have had the benefits of having volunteers for one-day efforts as well as for like once-a-week type of efforts. But we're very much looking forward to strengthening our ties.
Good afternoon. I'm Stacy Froling. I'm the Chief Operating Officer for People's Community Health Centers and the Director of Behavioral Health. We thrive on student volunteers and have done a lot with SOURCE at year in and year out, which Dawn will address more because she knows more than I do.
I am Dawn Witherspoon. I'm the Chief Human Resources Officer for People's. We've actually worked with Source twice before. Once on a really big outreach project for HIV, Ryan White, and then a big project at our Greenmount site with patient education and diabetes, I believe, too, for patient education.
Good afternoon, everybody. My name is Laura Poindexter. I am the program director for Martha's Place, which falls under Newborn Holistic Ministries. We provide transitional housing in addition to long-term housing for women who have come out of treatment, preferably 28 days, but they can be referred from a shorter period of treatment stint, a shorter stint. And we work with them in our community. We've partnered with Hopkins internally through internships. So we want to see what the fit is and the benefit of this right here. So.
Good afternoon. I'm Leon Purnell, Executive Director of the Men and Family Center, formerly the Men's Center in East Baltimore, board member of SOURCE, and we work with students in a number of different capacities, fundraising, day of service, and I've had some individuals that work with us on private.
Good afternoon. My name is Christina Williams. I'm the Main Street Director for for East Monument Main Street. I am embedded in the historic East Baltimore Community Action Coalition. Our organization has used Source for many different things. Most recently, on April the 20th, we did a cleanup of the Ashland community where a lot of the Source students came out and helped with that. But I am actually interested in doing something for academic experience. We've never done that. Thank you.
Hello, I'm Matthew Minch, Manager Mission Delivery for the American Diabetes Association Maryland chapter. We've worked with SOURCE students a number of times on our special events, as also with our community outreach and education in the African American community about diabetes.
Hi, good afternoon. I'm Katie Sheffield from Caroline Center. We're just a mile away. We do workforce development for women who live in Baltimore City, training them to be farm techs and certified nursing assistants. And we use students for, we've used them for research projects and internships.
Hi, I'm Sister Pat McLaughlin from Caroline Center, and Katie just told you what we do, so.
Hi, I'm Larry Shugo. I'm Executive Vice President for the Baltimore Curriculum Project. We recently worked with SOURCE students at 2 of our schools on the Health Literacy Photo Novella Project.
Hi, everyone. My name is Alexandria Appa. I work for an organization called Health Leads. I'm the program manager there. We have 5 sites across Baltimore City, and we're in 6 different cities across the U.S. And so our organizations try to increase access to, my particular program works on the baby emergency department, and we're trying to increase access to primary care for uninsured and underinsured individuals who frequent the ED. And we worked with SOURCE for a long time since my program is launched, and we actually worked with a qualitative class. We worked with the COP students and also with the health literacy class. And the qualitative class that we worked with a couple years ago, like 2 years ago now, we just had a paper published, so they did really excellent work. That way.
I am Trish McGarry. I'm the director of Joy Wellness Center at Shepherd's Clinic. We are a freestanding health clinic that serves uninsured and low-income people in 3 zip codes in north central Baltimore. And the Joy Wellness Center, we provide individual wellness services to our patients as well as group wellness services to the entire community. This past year we had 3 SOURCE students, 2 nursing students, and 1 community practicum student.
Hello, my name is George Olson. I'm the volunteer coordinator at Shepherd's Clinic, and Trish just told you about the students we worked with, but we also have had students doing projects, some nursing students, and some social work interns as well. Thank you.
Good afternoon. My name is Ashley. I'm a outreach coordinator over at Sisters Together and Reaching. We have worked with SOURCE students and also other students from like Morgan State University on outreach programs and our outreach effort in recruiting, for HIV testing and education.
Hi, my name is Karen English. I'm also with Sisters Together and Reaching, and we have had, like Ashley said, SOURCE students come out to do outreach and also HIV and counseling and testing.
Good afternoon, James Wilson, Prevention Program Manager from STAR. Don't want to be redundant, but it's the same thing they just said. But the one thing I do want to add to it, we do go out every Thursday, the first Thursdays of the month, where we have the SOURCE students come out and help us test on the block. And they really enjoy that and really excited about that. And this is our third cycle with the SOURCE students, so we really enjoy them. Thank you.
Good afternoon. I'm Oyenade, and I'm from Big Brothers Big Sisters of the Greater Chesapeake. We're a one-to-one mentoring agency where we match children and volunteers in Baltimore County, Baltimore City, Anne Arundel County, Howard County, the Lower Eastern Shore, and a lot of other places as well. I don't believe that we have worked directly with SOURCE. However, we do host interns, and we do employ high school students to work at our front desk. So.
My name is Shawnee Jackson. I also work at Big Brothers Big Sisters of the Greater Chesapeake. I am the customer relations specialist. And just like she said, we typically bring in MSW students, so we are excited about the possibility of maybe having some MPH students coming on board.
Hi, I'm Natalie West. I'm from the International Rescue Committee, which resettles refugees in the Baltimore area. I'm here on behalf of myself and our volunteer coordinator, Kafia Ismail, who couldn't make it. I run our mentoring programs, so personally I've worked with SOURCE in a strictly volunteer capacity, but IRC has like tons and tons of Hopkins students all the time, particularly working with our health program, so we're excited to learn more.
My name is Mariska Jordan Lee. I'm the director of Jubilee Arts. We're a community arts center, the corner of Pennsylvania and Pressman. We serve the Sandtown, Winchester, and Upton communities. We offer classes in ceramics, visual arts, creative writing, and dance to people of all ages through a partnership with Baltimore Clay Works and Micah. We have worked with JHU students before through the President's Day of Service, as well as the Center for Social Concern, and looking forward to hearing more about SOURCE.
Thank you, Mariska. I'm Sarah Tooley. I'm the director of 901 Arts, and very similar to what Mariska is doing on the west side, we do on the east side in the Waverly community, offering free art and music programs as a community strengthening and community building tool in Waverly. And we've worked with many SOURCE students, mostly on the one day, so this is a new experience for us to do the academic.
So I've already been introduced, but I will say I used to work at Living Classrooms in the position that Jessica introduced. And I had the chance to work with some students as well through the Baltimore Curriculum Project, or sorry, again I'm confused, BCP, the Baltimore Community Practicum Opportunity.
I'm Deja Benton. I'm a student at Cristo Rey Jesuit High School. I'm in my junior year. I'm not sure if we worked with interns yet, but we do have Jesuit interns.
Good morning, good afternoon. I am Dawn Strickland. I'm the assistant principal at Cristo Rey Jesuit High School. I also serve there as the volunteer coordinator, which is why I'm here today. Deja is my student assistant. We probably have students at many of your organizations working as we have a work program through Cristo Rey. We began our partnership with SOURCE 3 years ago, and it kind of fizzled out, so I'm hoping to be able to rekindle that relationship here today. Thanks.
Well, thanks everybody for taking a few moments to go around and make sure we saw who's in the room today. A couple of you I know are newer at your organization, so don't necessarily know the history of how we have worked with you. And as we know, staffing changes. We need to rekindle when the staffing does change so you can know what's going on. So I also want to quickly mention one of our faculty members is getting rid of a fully functioning refrigerator. The catch is that you need to have transportation. So if your agency needs this for any of your clients or for any of your locations, just let us know, but we don't have the ability to transport it to you. I think they live in like the Roland Park area, so let us know if you need a refrigerator. First to claim it, it's yours. All right, so really today what I'm focusing on is the new MPH, which is the Master of Public Health. There's an MPH practicum requirement, and then I'm also gonna briefly touch on the growing number of service learning courses that we're offering in our schools. So very much focusing on some academic engagement opportunities. So let me first start out by giving you a quick overview of the upcoming MPH, Masters of Public Health, practicum requirement. So the reason why we have a new practicum requirement is that the body called CEF, the Council on Education for Public Health, that accredits all schools of public health, actually has a requirement that all public health students must have some kind of practical experience, or the practicum, when they're going through to graduate from the School of Public Health. Now, our School of Public Health is very different. We actually have an 11-month MPH program. There are only two basically one-year programs in the country. All the other schools of public health have two-year programs. And in their two-year programs, oftentimes they do their practicum requirement in the summer between the first year and the second year. So we are basically keeping our 11-month model and then adding on top of it, all the students have to have this practicum requirement. Now, Elizabeth and I serve on a small practicum working group. There's about 6 of us, 2 of us from Source, 2 from our MPH program office, and 2 from our school-wide practice office, that we're working to implement the new accreditation criteria. And a matter of fact, the students that are beginning this year are going to be the first group of students that every single full-time MPH student will be required to complete a practicum requirement. So what that means is 250 full-time students will need to be out and about working on a practicum experience. So you can obviously see why we wanted to pull you all together. We're going to have droves of students that'll be available to go out in the community. Doesn't mean they're all going to be working in Baltimore. Source only focuses on Baltimore City, but we think this is a fabulous opportunity for us to really reach out to our organizations and figure out how we can basically scratch each other's backs and how we can meet each other's needs. After this academic school year, the following year, this same requirement will be there for the part-time students as well. So that's like another 250 students per year. A lot of the part-time students aren't necessarily living here in Baltimore. Some of them are doing distance education, but I wanted you all to know that we have a big-time requirement that's coming down the pipe. Now, why a student practicum? What is this thing about? So really, the focus when we talk about the practicum is for all of our MPH students to have an opportunity for them to basically demonstrate the core public health competencies. So that thick handout that you have in your packets. This is just kind of a quick list of those different competencies that we focus on in public health. But in your packet, it gives a lot of different examples of concrete skills that a student could do to fall in any of these competencies. So, the communication skills are there, cultural competency skills, the community dimensions of practice skills, but there's also things like financial planning and management skills. Do you have budgetary needs? Do you have strategic planning needs in terms of leadership and systems thinking? So I really want to make sure that you have a hard copy to walk away with to really think through, because you won't really understand until you look through that document just how broad public health is and just how many things students could do. So the piece about this is they have the opportunity to apply these public health competencies, but we want to make sure that it's something that's related to the students' career goals. So one of the very first activities that we do with the MPH students when they come on board, they all have to take a public health practice course where we go through the competencies and they get to understand what they really mean, but then they kind of do a little bit of a self-assessment. They basically figure out, what are my current skill sets and what are the areas that I want to focus on? And this might be what sparks them to figure out, this is the type of practicum that I might be looking for. All this is also available online, the core competencies, if you want to print it out for anybody else, but there are those printouts in your packet. So main thing, they have to be focused on their public health competencies, and it's going to relate to the student's own career goals. Now, what can a practicum be? I'm going to give you some solid examples in a few slides, but some of the things to keep in mind is they have to be applying skills and knowledge. So what that means is they can't just be a standard volunteer that comes in and does the same thing day in and day out. They're not just going to be doing administrative activities. Oftentimes we think of it as, is there some type of project? Meaning there's kind of where they start and what you hope to get at the end. Okay? So that makes it a little bit different than, say, a big brother, big sister that's going to just kind of be doing a traditional kind of mentoring kind of role. There needs to be a more deliberate project involved. The other thing about the practicum is that it does require, every single student must have a preceptor. So in this case, oftentimes that would be you or somebody else at your organization that's going to have a role working directly with the student. And the activity needs to be planned, supervised by that preceptor, and also evaluated. And the evaluation piece here, we do have very standard evaluations that if somebody's going to be serving with you for a period of time, that you'll get kind of a Qualtrics, which is a platform very similar to SurveyMonkey, that you get an electronic midpoint evaluation for your student, and then a final evaluation for the student to make sure that they're meeting their goals and meeting their hours requirements as well. Now, Source, as I mentioned, Elizabeth and I are on that practicum team to bring this big project forward. So the main things that we do through Source is we're going to start to, this is our very first outreach, to let community-based organizations within our network of about 100 Baltimore City nonprofits know that the practicum opportunity is coming down the pipeline. So there's going to be various ways that we're going to be sharing this information. We do a lot of site visits to sites, and we'll talk about it with you in person. We'll have things that are online, and then we'll have all different kinds of meetings. So this is our first one. We're also going to be providing various training and information, and we need to do that for our students so they understand. We need to do that for our faculty members and also for the community preceptors that are going to be the ones oftentimes supervising the students. We also will have a role in reviewing projects. So one of the first steps that we'll do is kind of just brainstorm with you to figure out, does this sound like an appropriate project? So Source, because you're in our network of partners, we basically take the ownership of any of the organizations under Source that are going to be identifying or putting a project idea forward. And we'll be able to let you know if it sounds appropriate, what might need to be tweaked. There might be like a liability issue or an ethical issue that we could talk with you about a little bit more. And that's what we're prepared to do in terms of jumping these ideas back and forth. Another piece that we do is we're going to be helping students identify projects. So some students come in and they have an idea in their own heads of what they think they want to do. But what's really nice and what works even better is if we collect and work with you on a project and say, bam, on the silver platter, I'm offering you the practicum opportunity. It's already made. It's already been vetted. It's already ready to go. You can interview with the organization. You guys can decide you're a lovely match. You want to work together, and you're off. So one of the things that we do is basically tell our students and give them opportunity to say, this is what the community has identified, and here's how you can be involved. We'll have a website for the students that they can look through and figure out different opportunities they want. It'll be searchable, like if they're looking for a specific organization or a particular skill set, a population they want to serve. There's lots of different fields that they can help find you all. And then finally, the last thing that we'll also be doing is kind of the mediating any issues that arise. So this opportunity, the MPH Practicum, is going to be kind of open to the world, but because we have a network of partners through Source, we actually know who the preceptors are, and we'll talk with them about ideas. And so therefore, if you're having a trouble with your student that you're working with, they're not showing up, they're failing to meet expectations, talk with us about it, and we can help mediate that. And we've also done it the other way around. When a student and preceptor are working together and the preceptor hasn't lived up to his or her expectations, we're there to basically be like, all right, what's going on? How can we help to resolve any problems? So these are basically the main roles that we play through Source. Now, you as the preceptor or somebody else at your organization that might be interested in working with a student or a small group of students on an MPH Practicum. Main role is first, develop the project. What are you looking for? You know, what might be the deliverable that you want out of a student working with you? So it's really first brainstorming with your organization about your priorities and your needs and where a student can come on board and make a contribution. Then you're also going to be responsible for basically supervising and guiding the student through the project. So as you do with regular volunteers, you still have to kind of onboard them, give them that quick overview of your organization. If there are any policies and procedures that you need to go over, any kind of trainings, that would still need to happen. But then the student, it's not just, here's your project, run with it. You should be checking in to make sure that the student is going in the right direction. Make sure that you're communicating well enough that you don't say, here we go, start a project, and the project, student works on it for weeks and weeks and weeks, months and months and months, and comes back, and it's not what you wanted. So you should be kind of checking in periodically with your student to make sure that he or she is working well. As I mentioned before, communicating any kind of progress that the student's making, mainly through a midterm and final evaluation that will come to you through a Qualtrics online survey. are the main pieces of check-ins, if you would, throughout that process. Now, there are some key practicum requirements, and these are kind of the criteria that we're sharing with both students, faculty, and community preceptors. That means in order for any opportunity to actually be approved by the school and source, in your case, it needs to meet all these criteria. And that is, it has to have that application of public health skills and competencies. Again, going back to that core competencies document. It needs to happen within a public health context. For us, what that means is it's going to happen at your site for your populations that you serve, for your clients. The reason why this is really clear is that some of our faculty members might think, oh, this is a great way for me to get students to do some grunt work for me. No. They can't be working inside the school administratively behind the scenes. They need to be actually making a difference to an actual organization that's working with the public. So by being a community-based organization, you already meet that criteria. Qualified preceptor, there aren't specific criteria to meet to be a qualified preceptor. We are going to ask preceptors, because this is accreditation criteria, that if you will be precepting someone, that we get a copy of your resume. We're not reviewing it to make sure you have X, Y, and Z, but we need to have it on file to say, we do look at a resume. And the other piece is that if you're putting a project forward, that you as a preceptor are qualified by saying, I am willing to work with a student, I'm willing to evaluate them and make sure that I'm doing the check-ins throughout, okay? So you have to basically make that commitment that you're gonna make that extra effort to work with the student and not just say, here you go, do what you want. I already talked about the midpoint progress report and the evaluation by the preceptor, but the other key point is that the accreditation criteria requires that this be a significant experience. And for us here at the School of Public Health, we've said that's going to be approximately 100 hours of service on their practicum component, okay? Now, that 100 hours can certainly be divided up in any way, shape, or form, which can be great opportunity, or it could be, you're gonna get all kinds of asks from students. So some students might say, I wanna work like 2 or 3 hours a week throughout the entire year. Others might say, in this term, I wanna basically work full-time on 2 days a week or something like that. Typically what we see from our public health students is that 4 hours a week is doable, that they could commit to your organization for about 4 hours a week. 8 hours a week is sometimes an option. Technically, students can work more than that, but realistically, they don't, okay? They just don't have as much time as, say, an undergraduate student. They're master's level students that are not working on a semester system. They're working on terms or a quarter system. So their classes are 8 weeks long versus a traditional 16-week semester that many of you might be accustomed to some of these other universities that were mentioned. So 100 hours throughout their 11-month program. Now, I'll just quickly highlight this here, but you actually have a packet. You have in your packet the full template of what's going to be required when you're putting together a practicum opportunity. Basically, it's like, just quickly describe your project and your organization. What are the goals of that project? What might you foresee the student doing? And there's even within the system and within your packet, a lot of kind of radio boxes that you're just checking off. This is kind of the skill I'm looking for. These are the activities they could do. So it just kind of gives you some ideas. So I don't necessarily want to walk through that in too much detail because you have that in your packet. The other thing is that we have an online system for people to put that information in. Some of you that have done the Baltimore Community Practicum course before, like Margaret has this past year, are used to our online system, but we've made some tweaks to it for this upcoming MPH practicum requirement. So we will let you all know when that system is live and ready to go. Now, just to kind of get you thinking about some possible ideas, these are types of projects that could be appropriate, but I don't want you to limit to just these types of projects. I think when you look at the core competencies closely, you're going to start being like, aha, that could be a practicum opportunity. Any type of education, community health education, and awareness projects would all be appropriate. If there's any kind of grant research and writing that you might need, oftentimes that's kind of coupled with like doing a literature review and having more information to strengthen your grant proposal. And when we throw up that idea of grant research and writing, is talking about more like foundation and community level. They're not doing like NIH grants for you, which are really massive. Program improvement efforts. If there's a program at your organization that you would like to look at how we can improve it, that's a possibility. If you want some type of evaluation tool developed, a lot of folks have programs that you don't really have an evaluation tool. Let us help you develop an evaluation tool to implement, so that way you do have that evidence to go back to funders and your various stakeholders. Lit reviews on different topics, developing a curriculum for something that you might need. If you need to actually implement a new program, we can help with that. And then the last thing that I just listed in just a couple of the ideas is secondary data analysis. So data analysis projects are appropriate, but when it comes up with students, there's a lot of issues related to our institutional review board that we actually can't have that, any of the data directly connected to identifying information about your clients. That starts to be related to research, okay? So this is a little bit different. We are talking about public health practice versus research. So the restrictions that I want to talk about real quickly, hit on this a little bit. We can't do human subjects research, which basically means the reason why we can't do that is that students themselves cannot be a principal investigator. Oftentimes that needs to be a faculty member that serves as a PI on a human subjects research project. These are indeed MPH students that are still learning. So that means that they cannot be basically doing research with your clients, asking them sensitive information and personal information about them that's directly connected to a client, okay? They can't do like door-to-door surveys and that kind of stuff, because then you're talking about they're out and about doing research. There are some ethical considerations to keep in mind, and this is again where Elizabeth and I will be happy to talk with you a little bit more. Whenever something comes up that's related to vulnerable populations, youth under the age of 18 often need to have parental permission for things. So it's not like we can just go out and start talking to youth about sensitive topics. I can assure you, here, an example would be talking to youth about their sexual practices. That is something that would need to go through our IRB. So every time that something comes up where it's a sensitive topic or a particularly vulnerable population, we need to talk about that. And then there are also some restrictions related to HIPAA. So if we're talking about information related to your client's health that's connected, we need to just make sure that the student has appropriate HIPAA training and things like that before we just let them loose on your medical records. Okay. Now, let me talk a little bit about the time frame for the practicum. These MPH students are starting very soon. They come right before the 4th of July, and that's when they start their 11-month program. They basically have a summer term, and then they have 4 more terms throughout the year, and they finish in May. So there is a lot of flexibility about those 100 hours, but they basically are from July until May 15th is when they graduate in the year. As I've said a couple moments ago, 2 to 8 hours per week I think is completely doable, but to basically improve your chances of getting students, if you would basically welcome a student to work about 4 hours a week with your organization, I think that's your best bet. The other piece about this is, for us with Source, we're always recommending when our students are working with your organizations that most of their time they spend with you, that they're working on site. We've had too many projects that just fall apart when you're relying on communicating with your student via email and not seeing them in person, and things get lost in translation via email. So we're always recommending to our students, be meeting with your preceptor somewhat regularly. It doesn't mean that you have to meet with them each and every week. There isn't a requirement like that. But it might even be worthwhile to have a student kind of set his or her schedule to come in at certain hours each week and maybe just do a quick check-in with you each week, just to help manage the process. Now, what I do want to also focus on is that there's a course that I've been teaching for a number of years here at the School of Public Health, which is called the Baltimore Community Practicum course. My course, in and of itself, meets the full practicum requirement. The reason why I want to basically encourage you to think about the Baltimore Community Practicum course specifically when I talk about this practicum requirement is that there is a set infrastructure to working with the students. So I'm faculty in the Department of Health Policy and Management here in the School of Public Health, and I teach a course. And the Baltimore Community Practicum course, I have assignments that the students have to work on that they review with their organization. So I'm another kind of person that's working with that student and making sure that he or she is meeting set targets, and I provide them with feedback, but they're also kind of encouraged to continue working with you all. And we focus on kind of the values of academic community partnership and how we can work together. What I'll basically be doing starting in July, once my online system is live and active, is from July until almost the end of August, I'll be recruiting for projects for the Baltimore Community Practicum course and asking people to put in those projects into that online system. The online system is there because I can then review and approve and make edits with your approval. And then it also becomes a searchable field for the students. I just basically make something go live and they can see the opportunity and apply. Now, the course is a little bit different. It's a 16-week course. So they basically start in late October and work up until the winter break in late December. And then they come back again for the second half. Our students come back right after the MLK holiday. So it's pretty much late January to late March again. So it's like working for a semester, but it's not a fall or a spring semester. It's kind of split up. You're working the second half of the fall and the first half of the spring for your full 16 weeks. The other cool thing about the Baltimore Community Practicum course is that when the students apply, they actually have a deadline that they actually need to apply to be accepted into the course. They basically review all the different possible internships that are available through the Baltimore Community Practicum course, and they write personal statements about which of the different internships they might be interested in working on. And we have a review team that basically identifies the top several candidates for your organization. So one example, like Natalie from the IRC mentioned, our students are all over the IRC. They're in love with working with it. For the Baltimore Community Practicum course, I've had a couple of IRC projects every year, and I might have 40 students that want the IRC position, and there's one position. If I let those 40 students loose on Natalie, it would be a little much to handle. So what we do is we basically pare it down and we pick out the top 3 or 4 candidates and say, okay, Natalie, here you go. You can interview these 4 students and let us know, kind of rank order. This is our first choice, our second choice, our third choice. Or if somebody, that student, I just don't want to work with him or her, okay? The students have a couple of interviews and it's all a matching system. So there's a lot that goes into making sure that you are comfortable with the student that you're chosen instead of just saying, here's a student. You basically help make that match. So it's a controlled process. So I encourage you to think about that. Okay, so let me make sure that I focus a little bit on service learning courses that are growing in our schools and let you kind of digest this whole concept of the practicum. So one thing that I should share with you all is that this current academic year, SOURCE implemented a brand new program, which is a service learning faculty fellows program. And basically what has happened is that our students have basically said in all 3 of our schools, medicine, nursing, and public health, they have really rigorous academic schedules and then they don't have a ton of time. And they've said, we see our work in the community, these types of projects that we're doing, as a part of our training to be future doctors, nurses, and public health professionals. Can't we integrate this into the curriculum? So a service learning course basically gives us an opportunity to respond to community identified needs while also training a student. So there's reciprocity there. Students are going to gain and a community organization is going to gain. And service learning is a particular pedagogy that we utilize. So basically what we've done this past year, these are the 9 faculty members from across our 3 schools that we've trained in the service learning pedagogy. And they've each been given a small stipend to implement new service learning courses, and they've all been implemented this academic year. We are getting ready to train our next group of faculty fellows, and we've also brought on 3 community fellows. So we'll have 6 faculty from across our 3 schools, as well as 3 community fellows that will be training in the service learning pedagogy. And next year, we're going to make that opportunity available to other community fellows, that those of you that want to learn more about service learning, as well as with the faculty. And the hope is that we expand the number of service learning courses so that way students can basically have this as part of their training. And when a project like this is required in a course, they take it seriously. They're going to commit and sustain to the involvement they're working on with you because they're getting a letter grade. Whereas a volunteer, you know how volunteers are. Some are fabulous. Others kind of come and go, disappear off of the face of the earth, and might not be as reliable. When it's connected to a faculty member and a core requirement in the school, They take it a little bit more seriously. So the Faculty Fellows Program, again, training those faculty to incorporate service learning. We're growing the number of service learning faculty members here. We also are hoping that we strengthen the connection between our schools and the community, because we want to constantly make sure that we're having this back and forth dialogue. What do you need? How can we help? And sometimes we won't be able to meet your needs because it depends on the need. We have to have reciprocity, right? But we'll be able to figure out, yeah, that sounds something great that we could probably do. And ultimately, if we are actually working together, we hope to continue to have some type of involvement in improving the health here in Baltimore City, because that's the only place that we focus is Baltimore. So what we do through the Faculty Fellows Program, we have basically a 2.5-day intensive retreat with our faculty members. They have quarterly group meetings that we come together, and this year's group, actually, we required them to do quarterly meetings. They made us do monthly meetings. They really were a bonded cohort and talking about all different issues and challenges that arise. And then Elizabeth and I each serve as advisors to the faculty members to help them walk through their courses and make sure that all the elements of working with community are being done responsibly, respectfully, and again, reciprocity. This is just a quick highlight of the seminar that we go through, that 2.5-day retreat with our faculty members. They get to hear a whole bunch about the service learning pedagogy. They hear about many different models of academic community partnerships. We work them through a whole series of curriculum development steps for putting a course together. We talk about critical reflection because it's a key component of service learning. We help them with the evaluation and assessment plans for their courses. And there's also a lot of scholarship that's involved for the faculty members where they can actually publish based on the information that they're doing for their students' learning outcomes. Now, this is something that I want you to kind of relate back to your orange sheet. The bottom half of the orange sheet, actually it's the top half of the orange sheet, has a couple of the different courses that I'll mention through this slide. So the first group of courses that we have here, these are all some of the newer courses that we offer through that Faculty Fellows Program. So the Baltimore Food Systems course is basically listed on your orange sheet. If your organization has anything to do with food, food insecurity, access to food, students often do a project with our Baltimore Food Systems course. And this year, I think we had like maybe 6 different projects going on for the Baltimore Food Systems course, and students kind of worked on small groups. We had one group that was working with a WIC program. We had another group that was doing some outreach in some of our municipal markets. So if food systems relates to you at all, let us know. Children in Crisis is another course, and a couple of you had mentioned the Children in Crisis course this year. The Children in Crisis course is going to slightly change next year, and what we're going to be looking for is for our students to have some kind of direct interaction with youth at your organization. They did a lot of tutoring and mentoring this past year, so these become possibilities, but it's only going to end up being for a particular period of time. We're looking at 16 weeks, basically the spring semester is what we'd be looking at, late January through May. So if your organization has a longer term requirement, we wouldn't meet it, but if basically the equivalent of a spring semester would work for you, we have some possibilities of joining with that Children in Crisis course. We also have another course, which is a data analysis workshop course. Basically, if your organization has data that needs to be analyzed or put into different formats so you can utilize it to put some great reports out, I know a lot of us basically sit on rich data and we just don't know what to do with it and how to share it with others. Our students can help think through that. They can also do kind of comparison of data from various years of a program to see how things have changed. The one caveat to that data workshop course is that it does need to be de-identified, so it can't be directly connected to a person. We can't know that that is indeed Faith and her information. And that you actually have to have the data already organized. It has to be in an Excel spreadsheet. We had one organization that said, yeah, we have data. Here's the file cabinet, go through it. They don't have time for that. It needs to literally already be in some kind of electronic format so the students can use it. And that is also a spring semester, if you would, course. It is a 16-week course. The next course is actually a special studies in health policy. Oftentimes this comes up, it's going to change from year to year. There was a new Maryland Family Planning Works Act, And the students basically helped a couple of organizations that focused on that particular health policy to do a particular project. So if you have any kind of interest in health policy, that's a possibility, but it's a small group. Finally, the last one for the School of Public Health is the Program Planning for Health Behavior Change course. And this course, basically what we ask you to do is say, is there a health problem or behavior amongst any of your clients that you want to look to focus on? And what our students have really done this past year is they do a little bit of logic modeling to think about this, a little bit of lit review. And the main deliverable is they really put together kind of a focus group guide to talk with the clients, your constituents, about that particular health behavior change. So they're doing all of the planning for you. They don't actually implement the focus group, or sometimes they'll do a survey, but they do all the background thinking for you because this is an 8-week course. Okay, so if there's some kind of health behavior change that you want to think about, that's a great option. For the School of Nursing, I'm not going to talk about all of these because the very first course is actually a winter immersion course. And what we ended up having was a team of students that worked here for basically an alternative break in Baltimore. So that's going to still be going on. Some of you, I think Alex mentioned, she said the COP program. We have a community outreach program in the School of Nursing where we place students to work out in the community. It's not a 4 academic credit course. This course is kind of the prerequisite course for the COP, but then students are working 4 hours a week throughout the entire academic school year. But the last one that I will mention, that Bilkey's mentioned this year, is the linking primary care to public health through service learning. So if any of you are at a primary care location, this is a possibility that we would have. These are graduate level nursing students. They already have a nursing certification that they can mostly do if some health education. They could see clients if you wanted them to see clients, but oftentimes what we had found is that the nurses wanted to not have to do the health education. They wanted more time to focus on the client. So what can our students do in terms of health education? Okay. And then finally, we have some School of Medicine courses. Both of these courses are a little bit different in that our med school, we have a whole slew of service-based student groups. So oftentimes what we find is that our med students are already volunteering, and we want to have courses to help them sit and actually reflect on how their volunteer work connects to their professional goals. So we have a lot of student groups that work with at-risk youth, and so there's a course to bring them together. We don't actually do the placements, they're kind of already volunteering. So those are that's why you don't see all of those courses listed on your little orange sheet right there. Now, I wanted to kind of quickly highlight for you the impact that these service learning courses have had on our students. For them, again, from the student perspective, they have a better understanding of their self. They kind of build their confidence and do a lot of teamwork. There's a lot of talk about professionalism and kind of their core values. But students have also expressed time and again that they better understand the theory that a faculty member is talking about when they have a practical application out in the real world. So they say, kind of like adult learning style stuff, I learn by actually doing versus just reading and seeing a PowerPoint. Like, let me actually get my hands involved in there. They also learn a lot more about building relationships. So these are future nurses, doctors, public health professionals that sometimes they might not have had much one-on-one experience with populations. So this gives them an opportunity to do so. And then a lot of what's involved is critical thinking. So I'm involved at your organization. What does that mean for me? What does that mean for my community? What does that mean for larger social determinants of health? A lot of the service learning is we're getting them to think about, you know, that's great. I hear you're telling me what you're doing at your site, but what does that mean for you as a future professional? And what does that mean for your communities? The other thing that we'll share, this is from this year at one period of time when our service learning course evaluations, and that is that 85% of the students in these 3 courses said that they would not have learned as much from their course without the actual hands-on service learning piece. So the students are basically craving these kind of opportunities, and we're doing our best to kind of expand and grow the number of courses that are offered. Now, for our CBOs, our community-based organizations have said, you know, we really enjoy engaging with the students, and the students have been there to basically contribute to our organization's mission. Some organizations have benefited from additional access to Hopkins resources. And then certainly just kind of the networking opportunities that come up from just being involved. These are just a couple of quotes from organizations that were involved with service learning courses this year. I won't read them all. First one was just, I feel that the work submitted by my team of public health students was useful to my organization. They created a great plan for our program, Recess Baltimore. And this is from the American Heart Association. They work with that program planning for health behavior change course that I mentioned a few slides back. Now, a couple of key things about service learning courses. As I mentioned, our courses are a little bit funky over here. Typically, you're going to see 8-week courses. So that's fast-paced environment. What we do if you're going to be working with one of our courses is we try to make that match in advance of the course. And we work out all the logistics in advance of the course so you know when the students are coming, when projects need to be due, and what's going to be required of you working with those folks. We also help define, like, what are the actual concrete deliverables? What can you expect out of this relationship? And then the other thing that I'll mention to you is, yes, you all have the orange sheets today, but in probably late June, early July, you'll be receiving our student recruitment kit. It's our annual booklet that comes out every year, and attached to it is a checklist of our annual community involvement opportunities. So you'll basically be able to check off all the different programs, courses. This is just a focus on new academic stuff. There's old academic stuff and volunteerism stuff as well. And what we tell organizations is that in order to remain a community-based organization partner in good standing is that we want you to fill out this community involvement opportunities checklist each and every year. You'll have a hard copy that you can fax in or mail in, or we'll have it online. But it's basically saying to you, let us help you help your organization. Some of these courses are only looking for like 1 or 2 projects. So if any of this sounds interesting right now, I would encourage you to check it off. Doesn't mean you're committing to a project at all. But if I have a course that only needs like 2 or 3 projects and you do not check off that checkbox, I'm not going to send it out to the entire network of partners, and we're not going to call you to say, hey, let's talk about any project ideas, okay? So basically, anytime when we put out blasts over email or this community involvement opportunities checklist, it's going to come along with student recruitment kit, please respond. Otherwise, you might be skipped over altogether because other organizations are responding. All right, so Elizabeth's going to come up and talk a little bit about trainings for community preceptors that we'd like to put together.
Hi, everybody. As Mindy introduced me earlier, but I'm Elizabeth Doerr, the Associate Director of SOURCE. And so basically, this is a timing thing because we have decided to put together training, an online training module for community preceptors. And this is specifically for academic partnerships. So, and just FYI, if you have any ideas, keep thinking about them, and I'll give you some information now, but we want to get some brainstorming here as well. So the reason we have decided to do this is that we have a growing number of service learning courses, as Mindy just mentioned, and we're going to continue to grow as the Faculty Fellows program grows and we can support more courses. And obviously, right now, there is no current standardized training for preceptors, and so we'd like to make something standardized and have it be something that our CBO partners can contribute to as well if you have ideas. We're currently working in the brainstorming stages with folks who put these online modules together. This also comes from feedback from source partners. So I've had, especially this last year in working with some of the courses, I've had some CBOs say, you know, I really would have liked more information about how I could be involved in the reflection process or the oversight of the project. What would what is my role in that? And so this was like, oh, well, this is perfect timing. We can put together this online module that at least would not answer every single question, because a lot of it would be, it depends. The answer would be, it depends, but at least give CBOs and preceptors a way to the questions to ask to the faculty members. And then also, as you know, the JHU Health Professional Schools schedules are very unique. They're not, we're not on a strict semester timeline, and each school is different. And so this would also be kind of an orientation on how it works in the different schools. So what it would roughly look like is an online training. It would introduce resources for preceptors. So we'd show you what all the source resources are, and also the courses. And then hopefully we're trying to make it more interactive and engaging, which is something that we have discovered this software that they use at the School of Nursing, and hopefully if it's not too expensive, we'll use that because it's interactive and engaging and much more fun than just watching a video and taking a quiz. And so there would also be an assessment piece, not a hard and fast test, but really just gauging your understanding along the ways, and then resources for follow-up, of course. So what we're envisioning thus far, the purpose and the outcome, is that preceptors taking the online module would have an understanding of source and faculty expectations for preceptors. They'll identify and describe resources that will support their work, and then also identifying ways to expand the scope and impact of your work. So hopefully it will give preceptors ideas of how they can guide students in the specific projects, or even give you ideas about how to develop projects. Identify and apply rules, liabilities, and risk management. As Mindy had mentioned, there are some restrictions to the type of projects you can do. And also, especially when working with vulnerable populations, even in just a volunteer setting, some things might arise that the student can't handle. And this will give an overview of what the rules are on part of the school, but also ways to navigate and troubleshoot. And then also just the most important, increasing preceptor comfort in the role as a preceptor. And hopefully we'll be able to answer some FAQs in those in the module as well. So that's pretty much all we have done so far with the module. And that's because we need some feedback from preceptors. And so one of the things I'd like to know from you, because it sounds like the majority of you have worked with students in somewhat of an academic capacity, if not Hopkins students, at least some students. So what are some barriers that you might have to be a preceptor for some of these projects? Are there any that you can think of? Confidentiality of the clients. Yeah. Yeah. Okay. Make the time to be a preceptor or to take the training? Both. Okay. Taking time, like I said, mm-hmm. Take the time, mm-hmm. Take the time to get the help. It's always a challenge. Right. Got it. So that would be one of my thoughts. You mean, so if there's a problem that arises, taking the time to actually contact somebody, is that what you're saying? Mm-hmm. Often in our roles, in nonprofits, you're always so overtasked and overworked that you're always just pushing forward. People taking on practicum students, mm-hmm. internships, there's a moment of, oh, I don't want another responsibility. Right. So if I'm serving in a director role or a volunteer role to help them find support, then and then you do training before they can have that support, I'm afraid of that moment. Okay, great. Any other thoughts? What were barriers to precepting? Mm-hmm.
Echoing back on it, I think the first big question that comes to mind when I talk to people about taking on a student or a volunteer is, how much time it's going to take. And mm-hmm. So this could be really useful in clarifying that and, setting the expectations so at least it is set out, this is how it's going to go.
These specifically would be the responsibilities, yeah. Yeah, and also something we do try to do when we're working with faculty member, kind of negotiating between the faculty member and the preceptor, is to define those, because in some cases we'll have a project that a faculty member wants to do, and Mindy and I are like, no, that's not going to work. So, but I think you're right. At least there are some things that we don't cover in that negotiating process that would come out during training. So, and this, if you have ideas, we will actually take these and put them into the module since we're really at the beginning stages. But for anyone who's precepted, what do you wish you knew about precepting before going into it? Any ideas? Everything that we told you today? All right. Well, if you have any ideas of elements that you think that, or do you think that there are elements that you would like in this module? Maybe reframing the question instead of what did you wish you knew, is there any specific element that you think would be useful to preceptors? Mm-hmm.
Understanding what role they play for that specific person in that specific program in a mentoring way. Really getting down to that for 4 hours a week if the person's doing a program, but also if they want to learn by doing, how much job shadowing do you want to see? Really kind of giving percentages of what they should get out of their specific job would be great. So
Of what the preceptor would get out of their job?
the person, so telling the preceptor 20% of this should be them seeing you in your work. 20% of this should be them doing some kind of program development for you. But kind of breaking out so that the preceptor really has a clear, defined way of what with this student in this role they can help serve.
Got it. Okay. So defining of roles and time spent on what type of role. Mm-hmm. Mm-hmm.
You meet with them, you can say, well, here, I understand my instructions, so I want to make sure that you spend a certain amount of time with me in case they wonder why am I following you around today or next week. Say, this is going to be part of the experience. So we don't want them to feel like that we're abusing the privilege, but that we're actually doing it with a real rationale and an expectation. Really outlining the evaluation process.
So when you say outlining the evaluation process, do you mean how they are graded in their course, or mm-hmm. how they can evaluate? Great. Mm-hmm.
If you're going to host a student as a preceptor for, say, a year or two, for 2 of the terms, I think it's very important that when they come to you, that you've set up time that day, their first day,
Mm-hmm.
to do all that administrative, like a welcome packet.
Like an onboarding kind of.
What happens if it snows and we're closed? How do we get into contact with you? Because I think a lot of times, because they're seeing as students, you forget that they are acting and it's like taking on another staff person. You're the supervisor, so making sure you get all those administrative tasks out of the way. It makes them feel welcome, makes them feel part of the team and all that.
Yeah, that's great. That's a great idea.
We had an experience a couple of one time. I clearly remember not a Hopkins student, of course.
Of course not.
The student group really did not a very good job
Mm-hmm.
at all, and passed the course. And the instructor had no accountability to us at all.
Right.
So in some ways, involving the instructor needs to know what's going on.
Yeah, so the communication process, especially in the evaluation of this. Yeah.
Took our time, used our time and our resources.
Right. Yeah.
I need to work that in there.
Oh, yeah, we'll work it in. Yeah, Leon?
If you want to work that in, you should have that in coordination with the instructor, so that the communication is on the same plane across the board.
Yeah, great, thanks. Noah?
I'm going to take my source hat off for a minute. When I was on the other side, I didn't know what a preceptor was, and I know that contextually that was easy to figure out. But in terms of reading an email and trying to go through the bullet points, it's like preceptor. Am I a preceptor? What is it? For the sites, that's a site supervisor, and that can seem like a small thing, but it's really big in terms of coming out of the high So I would have found it very, I figured it out pretty easily, but I think some knowledge of even understanding, say, oh, what is freestyle?
Yeah.
It's basically free size.
Yeah, because that's, I mean, it's language that we use here, and not necessarily what's happening outside of the school. Yeah, Alex?
So I had a really positive experience with working with the qualitative class, but just knowing, A, what skill sets the students actually come with, and having to make sure that they're identifying that and making sure that obviously matches with what we need, as well as, it took like 2 years to publish this paper, so just knowing that if that is the goal of that student or that group, to know that you will be working with them for longer than you may think you're working with them. So just being sort of aware of that, because I didn't realize how long it was going to take to publish.
Yeah. No, that's actually a good point, because in some of our courses, the project itself might be done, but there is sometimes